The adductor drop test is one of the fundamental assessments for how positioning of your hip in relation to your leg or vice versa is occurring. You want to do this both on your left side and on your right side and compare the differences. For the actual assessment yourself, we start in a side lying 90-90. I have 90 degrees at my hip, I have 90 degrees at my knee, and I'm resting on the ground. You can, of course, use a towel under your rib cage or under your head to feel more comfortable. From this position, I'm going to keep this 90 degrees at my knee, but I'm simply going to move my leg back until this upper leg, your femur, is pointing directly away from you towards this, in this case, this wall. From here, I'm just going to gently let gravity take over and see if I'm able to touch the inside of my right knee to the ground. I'm not forcing this, I'm just letting gravity bring my leg down. In this case, my right knee is not touching the ground, however my right foot is. If this knee came forward, that would be a positive test, meaning something is not appropriate on this side. If, in my position here, I can't touch the inside of my right knee to the ground easily, that would also be a positive test. Negative test implies you have no problem. So think N negative means no problem accomplishing the movement. You would want to switch over and do this again on your left-hand side with your left leg and compare the results.